At 5, when doctors told a local woman that either she or her unborn child or both would likely die during childbirth, her world was turned upside down. Health editor Dr. Maria Simbra has more on how they both survived against the odds.
Joy Lauver has a life-threatening lung condition called pulmonary hypertension, a side effect of the chemotherapy she received for an earlier bout of leukemia. She didn't think much of it, aside from some mild breathing issues when climbing hills or stairs.
I wasn't really familiar with what the pulmonary hypertension was and how serious it could get.
Then she found herself 30 weeks pregnant and in a lot of trouble.
We lose probably 60% of the women who become pregnant who have this disease, and the fetal loss is even higher.
It is a rare situation, only 1 in every 100,000 pregnancies. Dr. Kane has taken care of only one other case 15 years ago, and the mother died in the week following delivery.
It's one of the few conditions where pregnancy is contraindicated.
Joy's family rushed her from Altoona to Pittsburgh to see a cardiologist emergently. She went immediately to the cath lab where doctors found the blood pressure in her lungs was higher than the pressure in her arm, an extremely dangerous situation that could lead to sudden collapse of circulation.
Dr. Benz essentially said her pulmonary pressures were one of the highest he's seen. And combined with the pregnancy, his estimated mortality rate was as high as 90% at one point.
Pulmonary hypertension is a type of high blood pressure that affects the arteries in the lungs and the right side of the heart. As the pressure builds, your heart has to work harder to pump the blood through the lungs. The heart muscle weakens and fails. The condition becomes progressively worse and eventually fatal. From the cath lab, she went to intensive care, but the team tried to get her stabilized with intravenous and inhaled drugs that typically aren't used during pregnancy.
When the doctors come in and was telling me about the chances of us surviving, the birth and stuff, it was really heart-wrenching.
An ethical dilemma: save Joy or save the baby. She already had a 4-year-old and family counting on her. After much consultation and counseling, Joy, her family, the care team, and the ethics committee came to a decision to focus on Joy.
And our fear was that if the baby really had major distress where we had to deliver her, that she probably would not make it. We were going to do everything to maximize her life, even if it meant sacrificing the little one.
It would take time to get the medications working at their best to correct Joy's pressures. Because the pregnancy was aggravating her condition, an early delivery was the plan, but without pushing, because pushing would increase the lung pressures further. The goal was to get her to 36 weeks, but at 32 weeks, Joy's water broke and she had a quick, easy delivery in the ICU.
We thought that we will have to put a breathing tube, intubate him, and put him on ventilator, but he did well. He came out crying, and then he continued to stay well.
He was a good size and followed his growth curve to the amazement of the team. They expect his growth and development to be normal. After a month in the hospital, he's going home at 36 weeks, earlier than even a full-term 40-week baby would, and Joy's going home with an intravenous tube in her chest and special medicines to control the pressures in her lung vessels.
It's just a miracle, and we're just glad to be going home today after being over here for so long.
I'm Dr. Maria Simbra, KDKA-TV News.